Hi, I'm Dave Pounds. I'm 59 years old. I'm a big family man. Professionally, I've got three kids, two boys and a girl. Blessed with lots of friends. I really enjoy sport. And professionally, I'm a contract project manager. I've been in the corporate world all of my working life. And to the outside world, I've probably got an idyllic life. However, I'm here today to describe the journey I've been on since a tragedy in our family when I was 12, when I witnessed the murder and rape of my mum in our house. And, you know, back in the 70s, we kind of got on with it. My dad thought that was the best way to do it. So had a day off school and went back to school, and to all intents and purposes, life kind of got back to normal until, you know, in my late teens, I started to experience what I now know as PTSD symptoms, horrendous panic attacks, horrendous bouts of fear that would lock me in for days. And over the years, I've tried dozens and dozens and dozens of treatments, spent a lot of money, traveled many, many miles. And, you know, I've tried all the drugs on and off label, many, many other therapies in the private sector. And my experience is that pretty much all the tools we've got to treat psychological disorders are fairly blunt and ineffective. But I've never given up hope. I've always been looking for answers. And a few years ago, I stumbled across Ben Sessa. Whilst I was Googling various things, met Ben, managed to get on the MDMA trial for alcohol, which was a perfect fit for me, as in 2014, when things just became so overwhelming. I just hit the bottle for weeks and weeks and weeks, ended up in hospital for 5 weeks. And I've been sort of trying to rebuild my life since then. The MDMA trial was quite remarkable for me. I had two quite different and two quite remarkable experiences under MDMA. The whole trial was, I felt during the whole trial that I was looked after and I was safe. I did have some anxieties about taking MDMA, but the guys were brilliant in sort of educating me and guiding me to an understanding where, you know, I felt safe and ready to do some therapy under MDMA. The first experience was really quite remarkable. I got to a point I felt very lucid, completely sober, very calm, and part of the therapy is you put an eye mask on and just see what comes up. What came up for me was I was in my bedroom back at home as a 12-year-old, and the last time I was in my room, I was just frozen with fear after knowing something bad was happening downstairs. The perpetrator came up to my room, and I pretended to be asleep, and his panicky breathing seemed to be hovering over me for a long while, although it was probably only a few minutes. So my experience in my bedroom is pretty terrifying. But under the MDMA, the room was well lit. I was sat up in bed. The perpetrator came in, and I looked at him and said, "I'm pretty sure I know what you've done downstairs, but I want you to know I'm not frightened of you anymore." And then my mum appeared, and she sat on the bed, and we started chatting to this guy and saying he was probably going to go to prison for quite a long time. And we were asking him why he'd done this, and that he probably needed to go away and work on that and try and get himself some help. Then me and Mum got up, walked over to him, gave him a hug and wished him well, which is just, I never thought, I've never thought about that event in that way at all. And it various other things came up, but the whole process felt like a cathartic experience. And after the MDMA had worn off, I stayed in hospital overnight, left the next day, and I had a kind of afterglow long after the MDMA had sort of worked its way out of my system. And I have this, what I call my MDMA mindset now, which I can foster almost at will, especially when, I'm getting tired or a little bit stressed out with life. And whilst I wouldn't claim I was 100% fixed, I would say that the MDMA experience has left me with an insight and a brightness and a calm, sort of warm feeling that I haven't had for decades. And it without doubt, out of all the therapies and treatments that I've tried over 40 years, the MDMA therapy has been the most profound. So if it was a legal treatment, I would probably contact Dave Nutt and Ben Sessa and see if we could do another 1 or 2 sessions to see how much further we could go. My frustration, and I've written to my MP about this, my frustration is I don't see why, governments aren't approving more research, more scientific research on not just MDMA, but other psychedelics. As far as I know, there's a lot of data supporting the efficacy of these types of treatment. And I think there seems to be, from my point of view, enough data to say that this is worth taking a serious look at. So I guess my message for anybody who is unsure or frightened, whether that's politically or commercially, this is something we need to have a go at. This could be the most profound change in treating psychological health for, well, probably forever. So that's my message. Thank you for listening to me.